Compassion and action. There is absolutely no question that our social workers walk with compassion each and every day. And whether you're a social worker in this room or you're watching online, we salute you. Particularly today, we celebrate you. But today, for the board, it's a day of action. Good afternoon, honorable members of the Board of Supervisors. I am Charles Barfield, General Manager of the Orange County Employees Association. I stand before you today on behalf of over 18,000 OCEA members throughout this county who dedicate their lives to public service each and every day. Today, we are here to address a crisis within Children and Family Services Division within SSA, a crisis that threatens not only the well-being of our OCEA represented members, but also of the vulnerable children and the families that they serve. We recently conducted a comprehensive survey of CFS social workers, and 225 respondents shared their experiences, shared their concerns, and shared their suggestions. The results are stark, and they are deeply troubling. 73% expressed no confidence in CFS executive management. 72% are considering leaving or transferring due to a toxic work environment. 81% report serious impacts to their mental and physical health. Now, recently, a mandatory rotation policy was implemented by CFS executive management. And I think that for Vice Chair Foley, you may have gotten an up-close and personal report. This isn't just a workplace issue. When we lose experienced social workers, we lose irreplaceable institutional knowledge, and they weaken the very system designed to protect. Now, 2 weeks ago, in the wake of the Treasurer Tax Collector, Supervisor Wagner rang an alarm bell.
Your time is up, but if the board would permit an additional minute? Okay,
15 seconds.
15 seconds, all right.
So in the wake of TTC 2 weeks ago, you called out and invited employees to ring the bell, don't wait so long, tell us so that we can fix what's wrong. You said speak up, so we're here speaking up, Supervisor. The crisis is decades in the making. This has nothing to do with the supervisor's request from 2 weeks ago. And today, on behalf of all of these workers, we're here to demand action. Thank you.
Thank you.
Dr. Tim Steed. The next three speakers are Judy Bowling, Veronica Rodarte, and Carolyn Gasca.
Hi, good afternoon, Chairman Chaffrey, Vice Chair Foley. Feels great to say that. Honorable board members, my name is Tim Steed. I'm the Assistant General Manager at the Orange County Employees Association. I've been with the union now for 18 years, and actually one of my first assignments was being a staff representative for the Social Services Agency. And the alarming survey data points that you just heard paints a very clear picture that CFS social workers are struggling under executives that do not support them, and the consequences of this failure are being felt by the residents that these professionals serve. We have tried for years to collaborate in good faith through MOU negotiated venues like a caseload management forum, or most recently a labor management committee, informal attempts, conversations with division heads, with managers, but at each and every time these concerns from frontline workers were dismissed. Their experiences minimized and their voices silenced. Instead of solutions, workers were met with gaslighting, retaliation. So many of them are watching from their offices right now because of a fear of coming in for such a meeting like this. Now, I mentioned I've been at OCEA now for 18 years as a union rep, and I know one thing for sure. If any worker we represented got the same feedback that these executives, you better believe they'd be put on a performance improvement plan, or PIP. And that's exactly what we are proposing here today. We want you to put a performance improvement plan on these CFS executives, and we have 4 areas that we're going to touch on. The crew here will be touching on in just a second that we want the executives to improve on. And that is leadership failure and accountability, communication and transparency, workplace culture and retaliation, and of course, addressing the disastrous mandatory rotation policy. Thank you for your time and attention to these matters.
Thank you. Next speaker, please.
Good afternoon, Honorable Board of Supervisors. I am Judy Bowling, Senior Investigator with the Orange County Public Defender and President of Orange County Employees Association. As you all know, given the recent developments on this board, leadership, effectiveness, and accountability are essential to any organization, but particularly for those given the public's trust. Workers describe CFS executive management as lacking strategic direction, setting unclear expectations, and fundamentally disconnected from frontline realities. These issues have real consequences. When leadership fails to understand the realities of child welfare work, they make decisions that actively harm both social workers and the children they serve. The mandatory rotation policy is a prime example. It disregards years of specialized experience, dismisses the complexity of child welfare work, and undermines the very relationships that are critical to child safety. One respondent put it plainly: these executives have not demonstrated that they have the interpersonal skills to lead a large organization. They are not servant leaders, but make it clear that they care about themselves above their workers. Effective leadership is not about issuing orders. It's about listening. It is about understanding the burdens carried by those on the front lines and working collaboratively to find solutions. CFS executive management has consistently failed to do this for many years. When we asked CFS social workers to rate their executive management, 56% responded does not meet expectations. We asked the board to require that CFS executive management be held accountable, demand that they meaningfully engage with frontline workers, insist on solutions that prioritize the well-being of both staff and the children and the families they serve. Thank you.
Thank you. May we have the next speaker, please?
Hello, Honorable Board of Supervisors. My name is Veronica Rodarte. I'm OCEA Operations Manager. Today, I want to address CFS Executive Management's ineffective communication and lack of transparency. For any organization to function effectively, leadership must communicate openly, honestly, and consistently with its workforce. But in CFS, employees report that communication from executive management is inadequate, misleading, and at times completely absent. This failure creates confusion, distrust, and disengagement among the very workers who shoulder the responsibility of protecting the most vulnerable members of our community. Town halls and labor management committees should be spaces for dialogue and collaboration. Instead, workers describe them as performative, a way for leadership to check a box rather than engage in meaningful discussion. Communication in CFS is largely one way. Decisions are announced, not discussed. Feedback is not welcomed, and when workers do speak up, they are dismissed or ignored. CFS executive managers are perceived as unavailable, unresponsive, and evasive when concerns are raised. Worse, inconsistent messaging from different levels of management further compounds the problem, leaving workers uncertain about policies that directly impact their ability to do their jobs effectively. The erosion of trust has real consequences. When social workers don't know what to expect from leadership, when they can't rely on clear, consistent communication, it weakens the system designed to protect at-risk children and families. Honorable supervisors, transparency is not optional. It is the foundation of good leadership. The workers at CFS deserve leadership that is accessible, that listens, and that communicates with honesty and integrity. Thank you.
Thank you.
After Karen Gazga, the next three speakers are Alicia Green, Karenza Shepman, and Gabriela Hidalgo. And Mr. Chairman, Gabriela Hidalgo has requested a translator, so her time will be doubled.
Hello, Honorable Board of Supervisors. My name is Carolyn Gazga, and I'm a Labor Relations Specialist at OCEA. I'm here to address the severe breakdown of workplace culture within CFS, a toxic environment that is punishing employees out in record numbers. Our survey found that 72% of workers are considering leaving or transferring due to poor leadership, burnout, and lack of support. Even more alarming, 81% report serious impacts on their mental and physical health, including anxiety, exhaustion, and overall decline in their well-being. Employee morale is at an all-time low because leadership has failed to acknowledge the realities of this job. Workers are carrying overwhelming caseloads while struggling to balance their own well-being, yet their concerns are dismissed and their sacrifices go unrecognized. Instead of support, many experience a culture of fear and retaliation when they try to speak up. This environment does not just hurt workers, it directly undermines the agency's ability to protect children. When employees are afraid to raise concerns, when burnout is ignored, when workers feel unheard, the entire system suffers. We're calling on the board to require that CFS executive management be held accountable for their leadership failures, lack of employee engagement, and toxic workplace culture. Workers need meaningful ways to provide feedback without fear of retaliation. They need to know their voice matters. CFS employees should be able to focus on protecting Orange County's children, not on surviving in a stress-filled workplace characterized by fear and frustration. Thank you.
Thank you.
Honorable Supervisors, my name is Alicia Green and I'm a labor representative at OCEA. You may have noticed that the mandatory rotation policy has emerged as a theme across every issue that we've discussed today. That's because it represents the culmination of failed leadership, poor decision-making, and complete disregard for worker input. It has upended lives, threatens to deepen the retention crisis, and has or will continue to inflict real harm on both employees and the children they serve. Workers have made it clear that decisions like this are being made without transparency, collaboration, or logic. Management solicits input when pushed, then disregards it, leaving workers feeling unheard and undervalued. 55% of employees surveyed strongly oppose the mandatory rotation policy. One worker shared that this policy has created an environment filled with animosity, anger, fear, and anguish. We are worried about the increased workload, change in schedules, and being forced out of the agency. Additionally, those with legitimate medical needs have had their concerns ignored when seeking common sense accommodations. One respondent shared, "I submitted letters from my mental health providers that a change in my work environment may exacerbate my symptoms. These letters were not accepted by the agency." Other experienced workers were moved from programs they spent decades working their way into and forcibly rotated into others that did not meet their physical needs. Instead of providing exceptions or identifying a rotation policy that actually works, these dedicated employees were put on a medical leave or retired while their former coworkers drowned in the sea of work that was left behind. The consequences of this policy extend beyond the employees and into the community the county serves. When workers are abruptly moved, their relationships with the children, families, community partners, and service providers are severed in the process. Trust is broken and the mission of protecting the children is compromised. The county must hold CFS accountable. We urge you to demand implementation of a more transparent approach, one that prioritizes the well-being of both workers and the children they serve. Thank you.
Thank you.
Honorable Supervisors, my name is Karenza Shutman. I'm a Senior Labor Relations Representative at OCEA, and I stand before you today not just as an advocate, but as someone who has lived this reality. I spent 10 years as a social worker in CFS in Orange County. I dedicated my career to public service, to children and families in their most vulnerable moments, investigating abuse, ensuring safety, navigating court systems, and making impossible decisions in the name of protection. That's the reality of child welfare work. It's relentless, it's heartbreaking, and it's necessary. Hundreds of dedicated social workers continue to work under unbearable conditions, not because it's easy, but because they know what's at stake. And that's why I stand here today. I left my position at CFS, but I did not leave this fight. I could no longer stand by and watch my peers, my friends, the people who carry the weight of these life-altering decisions, be broken by mismanagement, indifference, and a system that refuses to protect them. The crisis at CFS is real, and it's urgent. Today, we are asking you to do what CFS executives have refused to do. Advocate for and protect these social workers the way they advocate for and protect this community. We are also asking you to stop the mandatory rotations and rotate out the CFS executives who created this crisis or place them on performance improvement plans. Install leadership that listens, leads with integrity, understands the weight of this work, and respects those who do it. This is not about retaliation, it's about responsibility. CFS executives have had years to fix this. Instead, they have ignored worker input, doubled down on harmful decisions, and created a culture of fear and instability. Each of you also chose public service. That choice, at its core, was about making things better. This is an opportunity for you to honor that choice, to show these workers that they are not indispensable, that they matter, and that they do, in fact, have leaders who will fight for them. Thank you.